I'm originally from India, and I grew up in a town called Cochin, which is in the southern part of the country. And I went to med school in a place called Thrissur, which is not too far from my hometown. And after graduation, I did my residency in Chicago and then moved down to St. Louis to do my fellowship at Washington University. As a kid, I enjoyed doing puzzles. Looking at medicine, it's more like a puzzle in itself, where you collect information from different sources. You get information from the patients, and then you interpret the test results, and then finally you put all the pieces together and try to get to the diagnosis and provide the best treatment possible. I felt it matched with my skill set, and if you look at all the different specialties in nephrology itself, this is one of the specialties which involves the most amount of math, the most amount of puzzles, and collecting information from different sources as much as possible, putting together. And this is somewhere I can make a lot of difference in people's lives. And this is what inspired. These are the two things which inspired me to go into medicine. The most important thing I prioritize is to make the patients quite comfortable. Having experienced things from a patient's perspective myself, I know how challenging it can be, or how stressful and anxious a doctor's visit can be. So first of all, I'd like to set the tone by making patients as comfortable as possible. And I also realize that you come into me with a lot of questions, and I do my best to make sure that encounters, the visits that we have are not rushed, and together we are able to make a shared decision going forward, and that should guarantee the best possible outcome. Apart from patient care itself, I enjoy traveling. I do enjoy taking road trips. I've traveled a lot through the US, and one day I dream to be able to get to all the 48 states by car.